My name is Lauren Kirk, and the organization I chose to do research on is called Heartland Family Services. I will now tell you a little bit about Heartland and who they are. They are a private agency, not a government agency, and a nonprofit organization. Their profession is social work professional, compassionate, systems-oriented helping services. Heartland is not associated with a religious organization. The website states that they achieve their mission through the efforts of 459 staff, 398 volunteers, and around 1,539 generous donors. Heartland has a reputation for quality programs, management, and excellent community service and customer service. Since 1984, they have been accredited by the Council of Accreditation. On this slide, I have attached an image of the logo for Heartland Family Services. They were founded in 1875 by representatives from 8 different Omaha churches to minimize duplication and deliver services effectively. Their mission statement is to strengthen individuals and families in the community through education, counseling, and support services. They provide many different services for the community. This includes counseling and prevention, financial support, housing, safety, mental health resources, child and family well-being, homeless prevention, and so much more. This organization relates really well with our community health class because Heartland makes sure the community is benefited and relates to what they provide. The Community Relations mission statement is, the Community Relations Department promotes the mission of Heartland Family Service through compelling communications, community engagement, and financial stewardship to inspire action. They focus on 3 areas. These areas include development, grants and contracts, and marketing communications. In order to make sure everyone is welcomed and involved, they have a culture of inclusion. They are committed to building a culture that values and celebrates diversity and also creates a trauma-informed environment. Heartland recruits and retains employees that bring various experiences and uniqueness to the workplace. They follow all of the pillars of trauma-informed care. These pillars are safety, empowerment, collaboration, choice, and trustworthiness. In order to carry out the commitments for culture inclusion in the previous slide, John Janetta, the president and CEO of Heartland, has included diversity and inclusion into the strategic planning and operations of Heartland Family Service. I will now read a quote written on the Heartland Family Services website from the president and CEO. This quote says, "Valuing diversity in all of its forms and complexities is a fundamental component of our ability to help the people we serve and strengthen our community. Understanding many of our clients has experienced some level of trauma, first as a child and then as adults. Heartland Family Service can only be successful if we integrate a trauma-informed culture into our daily work. This means our clients and our staff must first and foremost feel safe. They must trust us, and we must work hard to gain their trust. As agents of change, we must also carefully lift up and empower one another to achieve our goals. In order to do any of this important work, we must first see and cherish all that is unique and special about each person who works at this agency and who comes here for life-saving help." The resource groups bring together employees from different walks of life to connect on various levels, professionally and personally. First, Elevate allows employees to engage in mentoring and coaching relationships to enhance their personal and professional development. Second, Family First advocates for employees in regards to life and family planning by creating a safe and productive work environment as well as helping staff to achieve work life. Third, Link provides education, awareness, and support for all cultures in the workplace and community. Fourth, PRISM provides educational events and trainings, policy and procedure advocacy, and works with programs to improve the experience and services provided to the LGBTQ clients. Fifth, SERVE recognizes and supports service members, first responders, and their families at Heartland Family Service while bringing awareness and education to their stakeholders and staff. Sixth, Think Tank helps close the gap between knowledge and ability through purposeful collaboration by encouraging flexibility, creativity, and accountability. Lastly, Wellness Works is committed to promoting and empowering Heartland Family Service employees to increase health and well-being through educational opportunities, fun activities, and advocacy. Heartland benefits the community by giving them support financially, mentally, and physically. If they are in a tough family, life, or individual situation, they are able to be an organization the individuals can lean on and trust. They prevent adverse situations by providing the individuals and families with affordable situations to get their life back on track. Like said on the slide, I chose Heartland Family Services because they target every individual in the community. They also have the knowledge to give out reliable resources to the people that need them. They offer a wide range of programs and resources to the community as a whole. They do not have guidelines that are needed to get help and are willing to help out every individual that reaches out or walks in the door. If you are in need of getting help or resources, there are many ways you can contact Heartland Family Services. You can stop at their main location in Omaha, give them a call, or send them an email. If you need to find another location that is closer to you, no need to worry because there are more than 15 locations in East Central Nebraska and Southwest Iowa. I hope you guys were able to learn more about the organization I chose and gain a better understanding on why Heartland Family Services is an important nonprofit in our community. Thank you.